Yeah,
because
it's
it was
really,
really
really
good.
interesting because PCOS is not a disease that I treat a lot of, so I don't deal with it a lot, but Nadia does. So that's why we teamed up to work on it. If you look at how the disease actually happens, it really all relates sort of back to insulin. So if you look at PCOS, the disease, polycystic ovary syndrome, you've got a couple of things. One, you've got the hyperandrogenism. So that is the sort of facial hair and male pattern baldness and that kind of thing. You've got the anovulation and you've got the cysts on the kidneys. Now, if you look deeper into what causes this syndrome, then you can actually find that the reason for all this is winds up going back to insulin. That is, insulin actually causes the increase in androgen as well as a decrease in the sex hormone binding globulin, which increases the free testosterone, so it's more available. It causes the basically it causes the anovulation as well. So if you have too much insulin, what you get is a follicular arrest. So follicles are what develop in the ovary. This is what in a normal menstrual cycle you have follicles, and you get one follicle becomes a dominant follicle, which grows and grows and grows. Eventually, it pops out, an egg goes in, and that's how you get pregnant. You have the egg and the sperm. So what happens when you have too much insulin is that your follicles, they grow and grow, but then they stop at a certain point, and that's called follicular arrest. And because they stop, they don't the other follicles that are developing don't involute. That is, normally only one follicle develops and goes through. Everything else just shrivels up. So when you have follicular arrest, you have all these follicles which are developing and then they stop. Because you don't have the egg being produced afterwards, that's why you have anovulatory cycles, which causes the infertility. But because you have all these follicles which have developed a certain amount but not gotten any bigger, they sort of persist, and that's what gives you the cysts that you get for the polycystic ovaries. So in essence, what you've come down to, and the pathophysiology has been worked out for a long time, is that you have too much insulin, which causes the polycystic ovaries. You have too much insulin, which is causing the anovulatory cycles because you're not getting the natural maturation. And you have too much insulin, which is causing the hyperandrogenism, which is the facial hair, the male pattern baldness, and that kind of thing. So it's like, okay, so the entire syndrome is too much insulin. Well, what's the solution? Well, if you go to a normal book on PCOS, the solution is to give Clomid or something like that, right? Which is a fertility drug. I'm like, hello, there's too much insulin. Lower insulin, and you're going to get rid of the whole thing because that's your root cause, right? Again, people are conflating the symptoms for the disease. The disease is too much insulin, you got to lower insulin. It's not the disease is that I can't get pregnant. That's a symptom of the disease. So you can give Clomid or you can do in vitro fertilization to get pregnant. Yes, you can. Or you can shave and get labor, but you don't stop the actual process. That's the disease. The disease is hyperinsulinemia, lower insulin. And how are you going to do that? Well, low carbohydrate diets work, fasting works. So Nadia works with a lot of these, and she's like, I think she says she's had like 10 or 12 people get pregnant and had babies going through her program. It's like, that's fantastic. I mean, for people who have had trouble conceiving, it's an unbelievable mental burden. I mean, to go through in vitro and all this sort of stuff. And to know that you could have actually treated the whole thing and gotten it better, not just gotten the symptoms better, not just gotten pregnant or whatever, but to actually reverse the disease. Because the point is that it's not simply the you can't have a baby, which is a big blow as well, but you're also setting yourself up for sort of a lifetime of health problems with
You
type
need
2
to know
diabetes and
that
all that.
you have high risk for the other metabolic spectrum, like metabolic syndrome spectrum. So that's a message we really have to talk about it. And your book is amazing once more because it's very simple and accessible to all the women that think that having a baby solves the problem, and they're not they don't have an increased risk for metabolic diseases. I have lots of patients that are diabetic right now, and they had PCOS and got pregnant, but still had the problem. So they always ask me, why didn't anyone tell me this? Because